Hi, everyone. Today we're talking about returning to care, and joining us is Dr. Rajeev Kathuria, a cardiac surgeon from Banner Health. Thank you so much for joining us, doctor.
Thank you for having me.
We are talking about the fact that with the vaccine rollout, a lot of people are now starting to return to their normal routines, and you feel it's important to talk about heart health because during COVID, you saw some pretty extreme cases where people were putting off getting the medical attention because of COVID, right?
That's absolutely correct. So we saw a lot of patients during the pandemic who elected to stay home rather than get the necessary care that they needed because they were afraid of going into the hospital. They thought that they would catch a COVID infection at the hospital when the reality was the hospital was probably the safest place for them to be for their other conditions, such as heart disease.
And heart attack was one of those big extreme cases that you were seeing a lot of.
We actually nationwide and locally saw the same thing, which is that a lot of patients who were actually having a heart attack either ignored their symptoms or didn't get into the hospital in time. So as a result, a lot of people had damaged heart muscle that we could not fix. So the damage was already done, and patients ended up with a much weaker heart muscle than they would have if they had gotten into the hospital in time for us to thwart the heart attack.
And with people not seeking out the medical attention, that was something that you've witnessed even before COVID, correct?
Unfortunately, it's a fairly common thing that we see that people either don't recognize the signs of heart disease or have ignored them or attribute it to other things. Because there are other things that mimic some of the same symptoms that the heart disease would present itself as, and people would ignore these symptoms, and sometimes for months and maybe even years. And we see a lot of patients who don't go to their physicians in time. Later on, they might say, oh, I've had this going on for weeks or months or even years. So I think it's important for people to recognize some of the symptoms of heart disease.
Well, let's talk about those symptoms. What are those symptoms that people should watch out for, be alerted to, that they would want to see a doctor right away?
So heart disease can manifest in many ways. The commonest thing people have heard about or might have known somebody who have had it is chest pain or chest pressure. The commonest sensation that patients tell us they experience when they're having chest pain is really actually a pressure sensation beneath their breastbone. So that's a very common finding. But there are a lot of other things that people don't know can be manifested because of heart disease. And for instance, people may have pain in their shoulder going down their arm, sometimes the left arm, sometimes the right arm, sometimes both arms. They can have jaw pain or discomfort behind their back in between the shoulder blades. And other times it can just be as simple as shortness of breath with exertion, especially in diabetic patients.
And women, let's talk about that for a moment because they don't experience those symptoms the same as as men do, correct?
That's very true. So a lot of women have symptoms that are not the typical symptoms like we've just discussed. In women, it may be as simple as just feeling tired or having nausea, feeling lightheaded or dizzy, as can be those are the only symptoms they may experience. And many times those symptoms are not taken seriously even by physicians. And as a result, a lot of women with heart disease go untreated.
So the bottom line is, if you have experienced any of these symptoms or do, and you have any question whatsoever, you should go see a doctor right away.
Absolutely. If somebody's, we all know our bodies. And if you are experiencing things that are just not typical for you, rather than putting off care, I think you should always seek medical help. Call your doctor's office, go visit with your practitioner and tell them that, I'm having this or that, and at least rule out serious issues such as heart disease.
Important information, doctor. Thank you so much for sharing that. We appreciate it. And thank you for joining us. We'll see you next time.